timer, and here is your question. Right, so if you have read and understood considering it communication skills station, kindly please begin.
Okay. Hello, I'm Dr. Samreen, one of the surgical doctors, and I was told to talk to you about your child condition. Can you please tell me first what you know so far?
Doctor, I don't know very much. I was at my work. Then I got a phone call telling that my child is very much weak and having the abdominal pain, and they brought her to the emergency department. I don't know what's going on. Is she okay now?
Okay. Yes. Let me first tell you, you don't have to feel guilty because whatever has happened, this could have happened to anyone. So your daughter was brought here to the hospital by her teacher, and complaining of tummy pain. And
Yeah.
she was first. Our initial investigation showed that she has suspicions of acute appendicitis, and she was initially managed by our register, and received some antibiotics and also IV fluid. And now we are waiting for our consultant,
Okay.
who is going to operate on her. Okay.
Operation? Does she need that?
Yes, since we are suspecting that this could be acute appendicitis, and this is quite common in this age, and also her sign symptoms are also denoting to that. But we cannot be very sure. We cannot be 100% sure until we operate and see that she has this condition.
So you are saying that you will operate on my child and you don't even sure about her diagnosis?
Ma'am, yes, because her sign symptoms are showing and denoting to this condition, and this is usually common in this age. So once we operate on her, we'll be 100% certain about this appendicitis.
Okay, so you're telling me that you are waiting for your consultant. So can you tell me
Yes.
who will operate on my child?
This is Mr. Ladd, one of our
What?
surgeon. Yes.
Oh, doctor, I can let him operate on my child because
Okay.
he operated on my husband and he could not save his life.
Okay,
This
I'm
is
so
not
sorry to
possible.
hear about that. Okay,
I
I'm so
just
sorry
don't
to hear
want to
that.
Mr. Lat to operate on my child.
Okay, please take my sincere condolence. Please, can you just tell me what actually happened to your husband? Why did he uh, die?
Actually, he didn't even explain to us what happened in the operation theater. It was so unfortunate for us. We bought my husband for better management, but he could not save his life.
Okay, I'm so sorry. I'm
This is
really
a very
sorry to hear that.
unfortunate situation for us. So I don't want my child to have the same fate as my husband.
Okay, I
I don't
understand,
want him
ma'am.
to operate.
I understand, ma'am, but we need to know what exactly happened to your husband before the operation. How did he got ill? What
So what
illness
is the
did he
relation
had?
between my husband's disease and my child disease? Two things are totally different. He was elderly and
No.
he has another problem, not this kind of problem. He didn't have any
Okay.
appendicitis. So why
Okay.
it is
So
connected?
can you tell me what, because it's connected like um,
This
your
cancer, sir.
husband underwent, yeah, he had this cancer. So because he had this condition, which is quite fatal, and probably he actually died for that condition and not because of the surgery that he underwent and that Mr. Ladd did. So it's totally two different thing. And your daughter, she doesn't have that major condition, that is the cancer, and it's appendicitis. It's two different thing. And Mr. Ladd, he is one of the good surgeons, and he'll be operating on her, and you don't have to worry because your daughter is in good hands.
Okay, so can you arrange another consultant for me?
Yes, we can, but that would be a little time consuming because, and that might endanger your daughter's life. So I think that would be a little difficult for your daughter's life. So I don't think that will be a better option.
Okay, then you can. Okay, I will go with Dr. Ladd.
Okay, and
So
we
you are
and
telling me that operation must be done. But if you don't do the operation, what possible complication can she got? Do you have any
complications like
complication if I don't do operation?
Yes, because this condition, this appendicitis, this is specifically your children. Children specifically, they have less abdominal fat, and so there may be a chance of perforation, and that can
Good.
be particularly dangerous for her, and that may endanger her life. So it is
Okay.
wise to do the operation.
Because so my little girl, she will.
Don't worry, she is in good hands, so she'll be perfectly all right once it is the operation is done. And don't worry, this will take a small incision will be made on her left on her right lower region. It will produce a little scar, but we might need to expand this wound, and that can be quite a little bit disfiguring.
Okay, so she's a little child. Does this operation will affect her future life or conjugal life or anything else?
Yes, probably because if this is a severe infection, and this might block her reproductive tube, and this may result in subfertility. But there is another thing that there are two tubes. One, if one is not functioning well, the other is might be functioning. So maybe you don't need to worry about that.
Okay. Okay. Thank you, doctor.
Okay, and
Now
do
ask
you
when
need
I
to
can
know?
see her.
Oh, when can I see her?
Okay, as after she's let me see, and after she is done with her operation, I'll arrange an appointment for you.
Can I take home in that time?
Yes, she
Take
has
her
to
home?
recover first. After she has recovered well, and we have checked all the vitals are within the normal limit, then you can take her home.
So
Okay.
what would be the follow-up schedule, or what would be the drug, or anything else I have to take care at home?
Yes. The After the surgery is done, you need to come on a follow-up. We'll be providing her some antibiotics and some painkillers, and you will be visiting us, and That's it.
More,
Okay.
because
And
you're operating.
um,
So when patient will come back for the removal of the stitches?
Okay.
okay, yeah, the
10 days
patient
of.
will come for, yes.
So that instruction also you have to give. And how would you conclude this station? What are the concluding words you have to do? You have to summarize it for the mother.
Summarize.
Yes.
Okay. Ma'am, I had this confusion that do we have to summarize the entire thing again to the
You have,
patient?
because mother, you were practicing.
Oh, sorry.
Time ended, okay, but then
Okay.
I'm giving you 1 minute, and which is also about to end. I wanted you to come to that conclusion yourself, but since okay, time has ended, I'll tell you.
Okay.
In the beginning, mother will be, because here it says mother would be at work, and you call her and tell her about the child situation, and then she comes, because according to mother, child was at school. So
Yeah.
child comes in and is in that serious condition that child has to be operated. Mother comes home and she feels that maybe she has ignored or neglected the child, and then she's feeling guilty and she is crying. Mother is very emotional, very disheartened, and very sad. And then you have to calm her down, make her sit, offer her a glass of water, offer her paper to wipe her tears, relax her
Okay.
and calm her down. And then she's only arguing, why do you need to operate her? She will be like
Okay.
aggressively saying why you need to operate her, and the way you explain to her that it seems to be appendicitis and this is a serious condition. It can be serious if it can be fatal, if cannot, if it's not operated, can even lead to death of the child, etc., etc. And then mother asks all those questions, and you're relaxing it. And when she finds out that it's the patient is lad, surgeon lad is operating, and then again she'll throw it at you,
Okay.
sarcasm, and then you will relax her again, the way that okay, your husband's condition was different, this is another situation, these are two different conditions, and you have to understand it that way. And then at the end, when you have told her about the scars, disfiguring, I wanted you, because you'll hear the recording again, you'll realize when you were explaining about the infertility, you did not quite mention the word infertility and child can get pregnant and you don't have to worry. Like I wanted you for the next time to
Okay.
elaborate it a little bit more, so that
Okay.
mother will feel relaxed and she will not be worried anymore. And the scar, you
Okay,
said,
ma'am.
if we need to expand it, then it can be quite disfiguring. You just simply say that sometimes when we're exploring for the appendix, we need to elaborate or elongate the scar, and then it becomes disfiguring. But that is not
Okay.
as compared to saving the life of your child. Who cares about the
Okay.
scar when the life of a child is saved? So maybe you can add technically one or two words to make the mother feel more comfortable. And then
More
at the end,
comfortable. All
when
right.
she's arguing, okay, when can I see my child? You'll say, okay, I'll let you know when the child is out and is ready for you to be seen. Then at the end, you have to summarize everything, that why you are operating, why you've called her, and why you have to operate on the child. And then you say, okay, meanwhile, you're sitting here, and if any other question comes in your mind, I'm leaving my number here with the nursing staff, and you can call and contact me and you can ask me, because
All right.
patient
All
is in
right.
the theater, patient is not out, and you can't just say,
Yeah.
okay, I'll make sure and everything. If all the other unnecessary questions that she was asking, that when will I take the child home, what about the scar, what about the follow-up, etc., that question has not even arisen. Patient is still in the theater and she has not even seen the child. So that question can be taken up later. You can say, okay, once we'll give you the permission to see the child, then we'll explain everything for you. So that all
Okay.
the questions were unnecessary. So at the end, you can say, yeah, you can summarize and you can give the number to the mother, because child is still in the theater, it's not available for mother to see. And you can't, for children, you can't decide that, okay, 24 hours you'll keep them in medical care or observationship, and then you'll send home. You can't. You have to operate, and you have to see how well child gets or recovers.
Okay, ma'am.
So yes,
Okay, thank
you
you, ma'am.
will summarize at the end, and
Okay.
you will
The
even say
entire
the
thing I'm
number.
going to summarize.
Yes, and then you'll
Oh.
even say that, okay, I'll leave my number with the nurse. If any other question comes in your mind and you need to ask or seek help or seek question, then you can contact me.
Okay.
Ma'am, can I add
Thank you,
something?
ma'am.
Yes, please.
Yes.
At the first, we have to confirm that I'm talking with Miss or Mrs. X.
The name, yeah.
Yes, wife.
Okay.
Sorry, wife. I'm saying
Not wife,
mother
the mother of, yes.
mother of X. You
Yes.
can say by
Okay.
both. Like, can I confirm that I'm talking to Mrs. X, mother of Y, like
Or
this?
what is
Because
your
you have,
relation with the ex?
yes, like this.
Okay.
Yeah,
Thank you.
thank you. Thank you.
Thank you so
both of
much.